When a person suddenly clutches their chest and collapses, it may look like a single event, but for the body, that moment may have been decided weeks, months, or even years earlier. Most people imagine a heart attack as a lightning strike, sudden, unlucky, unpredictable. But the heart does not fail impulsively. It fails slowly, quietly, and reluctantly. It hides its warnings behind ordinary sensations and common complaints. And because those signs are easy to misinterpret, many people ignore them until it is too late. Signals from the heart rarely sound dramatic. Instead, they resemble everyday discomfort: a heavy stomach after eating, unexplained fatigue, shortness of breath on the stairs, a dull ache in the left shoulder, restless sleep, sudden anxiety, or waking up drenched in sweat. None of these are exclusive to heart disease, which is why so many patients assume it is indigestion, stress, or simply getting older. In fact, emergency physicians often say the same thing. Heart attack patients are usually the last ones to think they're having a heart attack. To understand a heart attack properly, we must look before the collapse. For example, a 52-year-old office worker had been receiving hints for weeks. He felt unusually tired, and after meals, a deep pressure lingered in his upper abdomen. Sometimes walking made him short of breath, and sometimes he blamed stress. He reached for antacids, smoked a cigarette or two, and went on with his day. Like many others, he believed heart attacks belonged to older people, someone in their 70s, not someone in their 50s, with work to do and responsibilities to carry. But collapse does not begin on the floor of a meeting room. It begins quietly in the arteries long before. Once the heart stops, time is no longer measured in minutes, but in seconds. After 1 minute without circulation, the brain begins to lose oxygen. After 5 minutes, the damage progresses rapidly. After 10 minutes, the chance of survival without severe brain injury becomes extremely low. Paramedics are fast, but even in ideal conditions, emergency response takes 5 to 10 minutes. That gap means survival depends not on the ambulance, but on the bystander. The most dangerous action in cardiac arrest is hesitation. Not all cases look the same. Take a 38-year-old woman with no history of hypertension, diabetes, or smoking. Her risk came from chronic stress, caffeine, poor sleep, and physical inactivity. She never considered herself a heart patient. In her mind, heart attacks belong to middle-aged men. But the modern lifestyle creates a different kind of cardiovascular burden, one shaped by cortisol, sleepless nights, stimulants, and sedentary habits. For her, indigestion-like discomfort, nighttime. Awakenings and breathlessness on stairs were dismissed as anxiety or fatigue when, in fact, the heart was signaling distress. Why do people ignore the body's warnings? The reasons are surprisingly human. First, discomfort is easier to rationalize than pain. Second, the heart communicates indirectly, borrowing the language of the stomach, lungs, nerves, and muscles. Third, fatigue and stress are culturally normalized, especially among working adults. Fourth, going to the hospital requires emotional investment time, fear, money, and uncertainty. And finally, one sentence prevents countless early diagnoses. It won't happen to me. A heart attack does not begin with collapse, it begins with plaque. Inside the coronary arteries, fatty deposits build slowly, narrowing the passage. The dangerous part is not the slow narrowing, but the sudden rupture. A plaque can tear within a second, allowing blood clots to form rapidly, blocking the artery and shutting down the heart muscle. People fear the rupture, but few pay attention to the buildup. Yet without the slow accumulation, there would be no sudden event. Arteries reflect lifestyle. In the past, humans naturally walked more. Before elevators, people climbed stairs. Before ride-hailing, they commuted on foot. Before screens and delivery apps, evenings were restful, and darkness signaled sleep. Today, one can live nearly an entire day without standing up. Convenience liberated time, but the body never adapted to prolonged convenience. The heart is a muscle built for movement, and movement is its cheapest medicine. Sleep is the heart's nightly repair window. During sleep, blood pressure drops and the cardiovascular system finally rests. When sleep is shortened, the heart loses recovery time while blood sugar, stress hormones, and inflammation increase. A single night of 4 hours of sleep can raise inflammatory markers associated with heart disease. Stress plays a similar role. It activates the sympathetic system, constricts blood vessels, raises blood pressure, and promotes clotting. This is why heart attacks peak during holidays, stressful seasons, or early morning hours. Alcohol and smoking also contribute, but in different ways. Alcohol elevates triglycerides, disrupts sleep, and destabilizes blood pressure. Smoking directly injures the arterial wall, accelerates inflammation, and promotes clot formation. Together, they form a dangerous combination. Diet matters as well. Highly processed carbohydrates, sugary drinks, and late meals overload. The metabolic system. The heart cares less about body weight and more about visceral fat around the organs that increases cardiovascular risk, even in thin people. Preventing a heart attack does not require extraordinary knowledge. Most prevention begins with modest, consistent habits: rising from the chair, walking after meals, getting sunlight, reducing smoking and alcohol, monitoring waist size, and tracking numbers that truly matter. The heart cannot be managed by intuition. It must be managed by data: blood pressure, fasting glucose, LDL cholesterol, triglycerides, and waist circumference. These numbers speak more honestly than feelings. Symptoms of a heart attack are both obvious and deceptive. Upper abdominal pain can be mistaken for gastritis. Sweating can be misread as anxiety. Breathlessness can be attributed to asthma. Chest discomfort may be interpreted as gallbladder issues. Women and people with diabetes are especially prone to atypical symptoms. For this reason, heart disease is frequently missed in its early stages. And yet the body rarely stays silent. The signs that often precede a heart attack include chest pressure, indigestion-like pain in the upper abdomen, pain radiating to the jaw or left arm, sudden fatigue, shortness of breath, ankle swelling, palpitations, sweating, or unexplained anxiety. None of these should be dismissed if they persist or appear in clusters. A heart attack does not arrive suddenly. The collapse is only the final chapter of a longer story. The more important chapters are written quietly through sleep deprivation, sedentary habits, stress, poor diet, alcohol, smoking, visceral fat, and unmonitored numbers. The body never leaps directly to crisis, it whispers first. Whether we listen or not determines the ending. If one thought lingers after reading this, let it be this: today might be the golden hour for someone who has not collapsed yet. The heart ages silently, but silence is not safety. The smallest decisions, standing, walking, resting, sleeping, checking numbers, can shift the course of the story for ourselves and the people we love.